So, welcome to another in our series of what we wish we had known. And today we decided to focus on what we wish we had known as supervisees and supervision, right? Because one of the things that we noticed before we became sex therapists is we didn't ask our supervisor very clear questions because we didn't know what to ask. But our supervisors also, until we became sex therapists and we were in supervision for our certification, um, didn't also sort of teach us or tell us what to ask, like what missing information there was from the case. So that's what we're going to talk about today. So Kelly, what do you remember like the distinct difference was when you were?
Oh, yeah. So for me, it was a big difference from going from like general therapy supervision to sex therapy supervision. I think it has a lot to do with the supervisor, right? Well, you were my supervisor. So it has a lot to do with the supervisor and what they're looking for, but also the field, like the niche or specialty. So when I was in substance use in general therapy, that's where I came from. A lot of my supervision was I would present the case and I would just present it very generally. Like, this is the person's name. They're on my caseload. This is why they're here. This is what we're working on briefly. This is how old they are. This is the intervention. And my supervisor would give back a little bit of feedback, but wouldn't be very probing about questions. And then when I came to supervision with you and sex therapy supervision, it was more detailed questions and more like learning how to conceptualize a case and come up with that full conceptualization before I present it, and like really thinking through, okay, how do I want to present this? What do I want to get out of supervision? What am I looking for? And then you would ask questions that would really be helpful in me understanding more about the case and what I should have been asking during my sessions.
Right. Yeah. And I remember actually what led me into becoming a certified sex therapist was I had been in practice for 15 years as, a couples therapist and an individual therapist. And I had some cases in my practice, and I really didn't want to assume, like, they had issues around low desire, and they had issues around erectile disorder. So a couple of different cases. And I just thought, I don't know enough. I need to seek out a sex therapy supervisor who can tell me what I'm missing from my hypothesis and from my treatment goals, because I feel like I don't want to assume it's all psychological. Like, I think that maybe there are certain specialties and certain, tests that they should be doing with a medical doctor that I don't even know what they are, right? But, so, and that still plays out today, right? So when a supervisee or someone who consults with me on a case says, they went to their doctor and the doctor did some tests and they said they were fine. And I said, too general. What doctor? What did they say to the doctor? What test did the doctor run? Right? So, like, if someone's having erectile disorder, like, they may run a testosterone, right? But what time of day did they do that panel? Was it early in the morning? We know that testosterone levels change throughout the day. What about anything in terms of the structure, the actual physical structure of the penis? Did they do anything to address or assess for damage? So, like, all of these things are, now we know this information, but we didn't get that from, our general supervisors, but we did get it when we got into this specialty.
Absolutely. That reminds me too of like consultations, right? So other general therapists that, are not supervising, but will have, maybe they're working with a couple and they just want a consultation on a sex therapy case. And I've noticed, the reason that they're coming for the consultation is because I'm able to ask these questions and I'm able to prompt them to think about these things in a way that they're not, because they don't have that same training. So like not only has my experience as a sex therapist and my training as a sex therapist, but also like my training as a supervisor and as someone that does consultations, that has helped me be able to help the other therapists think like, okay, well, maybe they're coming for something in regards to kink, and they want to know more about how to like talk in depth about kink, and they don't know that much about it. What are some resources? Asking like where the client's getting their information from, what the client is what they know about it, what the client knows about the kink, how are they identifying these things, and being able to specifically ask these questions helps the clinician then go back to the client and ask. Then they have a better idea of, okay, where are we going with this case? How am I helping this client here?
Right. And then being able to integrate that knowledge with psychological and systemic issues, which actually many of our supervisees or people who consult with us have already, right? So already people have their tools, but it's in the integration with the biological medication, spiritual, right? Because like we'll find someone presenting a case and we'll say, well, what religion are they? Do they practice? What religion were each partner, if they're in a relationship, brought up in, and the supervisee might say to me, oh, just, they're Christian. I said, well, what kind of Christianity, right? What part of the country, if they're American, were they raised in? How strict was the upbringing? Because each one of these things is information that may definitely have an impact on what their belief system is when it comes to marriage, relationships, sexuality, gender, all of this stuff. So going down a little deeper and asking more specific questions is, really part and parcel of really good supervision when it comes to couples as well as individual as well as sexual issues.
Yeah. Something that is interesting to me that you've mentioned before is like being able to get a feel for the person that the clinician is describing. Can you talk a little bit about that?
Right. Like, so sometimes when someone presents a case, they'll give me they'll give me facts, but like I don't have a sense of the person who's in the room, and I don't get a sense from the therapist how they feel with the person in the room. Like the energy, the affect, it's not coming through to me. So I really want to get a sense from my supervisees of kind of how are they talking about this stuff? This is very intimate information. Do they talk like it's no problem? Most people don't. Are they speaking kind of generalizing without actually telling you what the problem is? And are you having difficulty asking specific questions to say, well, can you say more about that? What do you mean? Or, would you like me to give you some ideas of kind of what people have presented here before as a way of helping people articulate, right? Because some people can't even say the words, right, that relate to their genitalia or their sexual behavior. So, so that's an important part of supervision, right? If you don't get a feel, it's not just facts and figures, right? It really is, how are they showing up in the room and what's the feel?
Yeah. And I think that's something for me that was different, right? In my general therapy days of supervision, it was just like the facts, boom, 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 not necessarily how they're showing up, unless like they were showing up in a way that was exhibiting like symptoms of use or like relapse, but not their general like energy or affect. Like that wasn't really talked about that much. And I found that that is such an important piece. And really, like, I wish that in my older supervision that I would have, like, that would have been asked, or I would have been taught that. But sometimes it takes, it takes getting a good supervisor in order to see like what you were missing before.
Right. And to jump on that, to piggyback off of that, there's the other piece of enactments. So a lot of people, therapists feel they may notice when a nonverbal thing is happening in a session, but they may not address it in the moment because feelings of discomfort or not wanting or feeling like it might be disrespectful. And I actually think that that's kind of a really good nugget of what is going on below the surface, so that if, like a partner says something like, I really just want him to, greet me at the door with a big hug and and their partner, meanwhile, is kind of rolling their eyes or even just subtly like closing their arms like this and moving away. That is such important information to say, oh, let me ask you something. I noticed something that was just what happened here. Can you tell me more about what reactions you're having to what he's saying? And the guy might say, well, it's not like new information. I've heard this before. Yeah, I bet you have. But what about this? What is this? Like, I'm getting to know you. I don't know what this means. Can you put that into a feeling state? No?
Yeah. I think something that's important too about supervision and is the supervisor being able to touch on like countertransference that's happening in the session. So really asking like, what is happening for you when they're saying these things? What is coming up for you in this room? How is that coming across in the session? And that's also something that like I didn't get that much in my earlier days of supervision, but it's so important because it helps us recognize where we're like what's coming up for us, obviously, if you're asking it, but in a way that's like, oh, how am I bringing maybe biases, or how am I bringing this to the questions that I'm asking, or how is that coming across in my energy that I'm bringing to the room, and then how does that impact like how I'm conceptualizing the case. And so having a supervisor be able to ask that is so important, and then the supervisee feel comfortable to talk about that, because I think in school we learn that like countertransference is such like this bad thing that you never want to do, but it's going to happen. We're human, right? And so being able to feel comfortable with your supervisor to talk through those things so that it does help your clinical work.
Yeah, it's so interesting you say that, because I grew up. I came up through with supervisors who were psychoanalytically trained. So actually, countertransference wasn't looked at as some negative thing necessarily, but as really a learning curve of what it's telling you about yourself as a therapist. What are your blind spots around certain types of people or certain situations that keep coming up in your clients' cases, and so knowing what your blind spots are makes you a much better therapist, because then you're aware of like, oh, here we go again. Here's this kind of person that really rubs me the wrong way, or here's this situation that just makes me feel so anxious because I feel like, how am I going to address it? How am I going to intervene? And learning how to do that in the moment is like gold, right? Because I find myself after 25 years in practice, almost 30, that there aren't too many situations that I haven't really seen or addressed and sort of figured out how to be and to be effective and how to stay with the client and not sort of give up. And the other thing I was thinking of too around this issue is I think not knowing how to address the non-verbal actions that happen around the sessions themselves, whether it's coming late, not following up on emails when they've missed a session, missing many sessions, missing payments. All of those can be, grist for the mill, as they say, and being able to just go, I'm just checking in with you. there anything in the last session that bothered you, or, and getting to that, and then sitting with it and addressing it with them. Like, that takes a lot of experience and confidence and grounding as a therapist. And it's not necessarily comfortable still after all these years, but I'm confident in addressing it. I'm not going to avoid it. I guess that's what I'm trying to say.
Yeah, that's been something important for me to learn, is that these things that are like administrative can also be clinical, and how to integrate that into the clinical work. That has definitely been a learning curve, and something that I'm grateful to have learned through this process.
Yeah. And that also includes like pay increases, which is something that we do each year at CLS, and and being able to bring it up, saying, this is something that we do, and this is how we get a raise, because we work for ourselves, and then seeing what the client does, because they say the big things that people don't talk about are death, sex, and money. Well, guess what? We're talking about all of that in session, and keeping an awareness of that in supervision is really, really important. Like when people say something like, it's not, we're not seeing that much progress. Like, why are we paying this money? I thought we would be done in, 8 sessions. Right.
Yeah, absolutely. Well, thank you everyone for joining us today.
Yes.
See you next week.
Yeah. And keep connected with us. Join our newsletter. Our email is eroticacademy24@gmail.com. Join our See It certification, which is now you can apply rolling admissions month to month. So thanks for joining us and listening.
Thanks.